and we're going to be chatting to Janene from Share the Road program at the United Nations Environment Program. Janene, are you there?
Yes, I'm here. And Janene is a lovely name, but just Janene is good as well.
Oh my goodness, I'm so sorry, Janene.
All right.
In South Africa,
it has a lovely ring to it.
How we spell Janine. I have no... We can be like Janene.
Very exotic, yes.
All right, Janine. Well, you're going to be sharing the results from the COVID Africa Mobility Survey. So please do take it away.
Sure thing. I think when we're ready, we have a video en route as well.
"2020 will be remembered for the COVID-19 pandemic. It's changed the way that we work, how we communicate, and of course, how we move. Right from the beginning, African countries took drastic measures to prevent mass infection. Lesotho, for example, declared a state of emergency before having any confirmed cases. In terms of mobility, strict regulations on physical distancing and hygiene standards on public transport were introduced in most regions, while in others, occupancy limits and reduced frequency of travel was enforced. Many have attributed the quick responses to the vast experience the continent has in dealing with infectious diseases. The elbow tap, that's been encouraged as the alternative to shaking hands, for example, was already used in West Africa as early as 2014 due to the Ebola outbreak. Africa has not witnessed the exponential spread that many initially feared. Currently, the number of cases account for less than 5% of the global total. But the journey has not ended. Experts have stressed that it's possible that COVID-19 will continue to be a significant part of our lives for the foreseeable future. The pandemic will continue to smolder for some time with occasional flare-ups. Does this mean that we will see more stay-at-home orders and regulations on movement? What will happen to those that are most vulnerable in our communities? And how do we ensure that those who cannot stay at home are empowered to move safely in our cities? What can we do now to ensure that mobility in Africa is healthy, safe, equitable, and sustainable going forward?
All right, great. Thank you. When you're ready for the presentation to come up, we're good to go. In the meantime, I will say good morning, all. What a pleasure it is to be and what an honor it is to speak after the Minister. Thank you for putting this together, to the Smart Mobility team and everybody behind the scenes making all the cogs turn. I'm just going to dive straight in. My name is Janene, and I work with the Share the Road program at UNEP. Share the Road is part of the Sustainable Mobility Unit at the UN Environment Program, and it was launched 12 years ago by UNEP and the FEAR Foundation. Overall, the goal is to develop policies or work with governments and donor agencies that act as a catalyst for systematic investments in walking and cycling. We work towards achieving benefits for the environment, safety, and accessibility. Now, in the last few months, there's been a lot of focus on the role of walking and cycling, micro and shared mobility because of the COVID-19 pandemic. We've seen kilometers of infrastructure being put up almost overnight in cities around the world to support and encourage walking and cycling. But as Simisola and from the Lagos Metropolitan Transport Authority and Chris from ITDP pointed out in the very first panel discussion of this event, non-motorized transport has always played a significant role in African cities. So we wanted to find out if this new increased focus induced by the pandemic would cause the perception of or value of these modes in policy and decision-making to be increased, and if perhaps it would instigate new policies or accelerate the delivery of existing ones. Now, in May, the African Union, together with the Africa Centers for Disease Control and Prevention, issued a guidance document for transport sector. Most of the guidance, I'm sure you would be familiar with. Passengers and staff should wash their hands before and after they've been on public transport. You need to wear a mask. We wanted to understand the broader landscape, but we were mostly focused on ensuring what is referred to as alternate transportation in the guidance document was being supported, namely walking and cycling. So in August, we teamed up with the Walk 21 Foundation and some researchers at Manchester University to figure out what was happening. We compiled a survey and had it reviewed by a collection of organizations, including the University of Cape Town, FIA Foundation, and the Global Alliance of NGOs for Road Safety. Then as a first step, we shared the survey with UNEP's high-level sustainable mobility contact database, and thereafter disseminated on social media. The survey set out to do three main things. Firstly, ensure that the support offered by potential international collaborators matched the needs identified by people working in the sector, to showcase good practice of mobility responses to COVID-19, and to collate an evidence base for future collaboration and action. In terms of responses, the sample size was small, but there was a good spread from different sectors. Most were from national governments, then international NGOs, and local NGOs made up about 15% of the response. Most of the respondents worked in the transport sector. We weren't able to get a response from every country, but we did get from 30, and the results were supplemented with research. We received mostly responses from East and Southern Africa. So here you'll see a map of some of the reported walking and cycling responses to COVID-19. Responses indicated that there was, for example, new footpaths and footpath widening and more space to walk in Nairobi, Kampala, Lusaka, Tanga in Tanzania, and Cape Town in South Africa. In terms of cycling, there were campaigns to encourage cycling in, amongst others, Nigeria, Egypt, Ethiopia, and also Ghana. Overall, however, only 20% of the respondents reported any action to make walking and cycling safer during COVID-19, despite the average modal share for non-motorized transport being almost 70%. Now, across the continent, that is. Now, this may seem a bit grim, but there are multiple reasons for this that I will get into in a bit. But luckily, we do have some brilliant innovations that have emerged in this period that we can shout about. In Ethiopia, for example, we just heard from the minister, so I'll keep it brief, but there's been an incredible focus on the needs of people that walk and cycle on a political level. This year, they launched their national walking and cycling policy amid the pandemic, and there's a lot of momentum of change. Like the Honourable Minister said, there's a need to create safer and a more sustainable future. In Ghana, the Statistical Services, or the GSS, partnered with Vodafone and the Flowminder Foundation and used data science techniques to support the government's response against COVID-19. The analysis aimed to identify the extent to which mobility restrictions put in place by the government were being adhered to. And the data then would help them to understand how effective the restrictions have been and then plan the next move against the virus. It's a very good example of a mix of institutions and organizations collaborating to address an important challenge like the lack of data. Then there are car-free days. In general, open streets movements have been very active in this period, but in Kigali specifically, for example, we can see the power of the interagency coordination and how it can result in something really wonderful. In Nairobi, the Nairobi Metropolitan Services initiated work on infrastructure in the Central Business District. Although very positive work, we supported, it's something that's been in the pipeline for a while and not necessarily a direct result of COVID-19. In several of the places across the continent where new actions have been implemented, these were most likely plans that were already in place. And it's possible that COVID-19 actually then just accelerated the implementation. Encouragingly, more than 90% reported that they were more aware of the value of walking and cycling since COVID-19, and also expressed a better understanding of the benefits of safe walking and cycling infrastructure. For most, the key reason for not taking action now was a lack of resources or having other more urgent priority areas. So for sure, more research is necessary. We saw from the Google mobility data, although difficult to directly compare, that people seem to have changed their mobility habits less overall because of COVID-19 than in other parts of the world. This is probably because of the perceived or real risk of running out of food, water, or money that's kept people in Africa on the move, and even perhaps increased their essential need to move. And I suppose it's on that note that we could really consider what we can do to improve that situation. We have an opportunity to step up the discussion, sorry about the pun there, around policy and interventions well beyond the immediate lockdown response in African cities. Transport policy commitments should move beyond intention to implementation to support walking and cycling as a solution to road safety, traffic congestion, poor air quality, and inequity, as a mitigator to climate change and a cost-effective investment to support majority trips, as well as improve the efficiency of feeder modes. Again, as was said in the panel discussion on what smarter mobility means, it's about having integrated systems. And as the minister pointed out before, it's about making sure that you have universal access. So what can be done then? In terms of building back better, we can address the inequity of essential infrastructure by investing in cities and the way that people move. We can do something with this new enthusiasm, build on the significant increase in awareness of the value of walking and cycling, and use it as an opportunity to gather resources and increase momentum. And of course, lean on each other. African countries and cities each have their own unique mobility systems, some with more elements of informality than others, but for sure we can learn from each other about what works and what doesn't. And we need to put greater emphasis on connecting academia and civil society to decision makers, and of course, the private sector. We have developed a new walking and cycling network in Africa, and for sure, after this session, if you're interested, you can reach out and we can have a chat about that as well. I would say overall, the countries and cities who most reported mobility responses to COVID-19 to date are those who had an existing commitment. They had relevant data, and they had capacity and supportive policy that could be enabled and accelerated. While the impacts and actions in reducing risk and saving lives are difficult to correlate with the COVID-19 data for now, the baseline conditions for walkers and cyclists in so many parts of the continent are often so poor that any recognition, investment, and change is likely to significantly benefit the community and safety overall. So, yeah, it's imperative that we focus on this going forward.
Well, Janene, thank you very much for that. Very insightful. If you do have any questions for Janene, you can put it in the comment section, and our tech team will add them to the screen. But maybe, Janene, you can just give us one of the key points that we need to take out from this. What is the key areas that we need to look at in the next couple of years going forward?
At the risk of sounding like a broken telephone, it's just
everyone's saying the same thing. Everyone's saying it.
I'm really driving home. Yeah. Focus on what people need. We need cities for people. Focus on what mobility actually enables. It's not just about moving from place to place. It's about, for example, as we said, accessing daily needs like food and school and money to survive. So focus on what people need rather than what might be perceived as progress,
Great. Well, thank you so much, Janene. We really appreciate your time. And I know you will be in a couple of networking sessions later, right?
Of course.
So so much. Paired with her. Otherwise, get in touch with her directly. And she has indicated that she will be willing to have a chat with you as well. So thank you so much, Janene.